And so here we are today. Dr. Sabine, as you all know, our wonderful holistic OBGYN, who always connects the dots for us and always gives us a holistic view on what is happening with our health and how to thrive in the world. So today we are talking about a very interesting topic, especially since a lot of us here in the Northern Hemisphere have been in lockdown for a very long time. So long, so much that we don't really know how to kind of be in the world, right? Can we socialize? Can we not socialize? And it'll have a lot of impact. But today specifically, we are going to speak about the impact that maybe none of us are even thinking of, is how much our postures are changing. And if any of you have done any sorts of practice from Alexander technique or anything, you'd know that the postural effects also going to affect your organ function. And I'm so excited we're going to dive into this more. So I'm going to hand over to our wonderful doctor, and then she is going to introduce our special guest to you all.
Good evening, everyone. I'm very happy and I'm very excited to be here tonight, as always on Monday. It's really, become our little routine. People bump into me and say, what's today's topic? What are we going to do on Monday? So it's like a fixed date, and it's really exciting that this has become a little ritual. And it's really something that I'm also looking forward to. And we're always thinking, what are the topics that could be interesting to our community? How can we enlighten the horizon, and how can we, help perception of things that are happening? And, I've been very blessed for many years to call my friend, but also my extremely appreciated therapist, who is a doctor in the greater sense, and really a magician of osteopathy. And everybody always says, osteopathy, what is that, physiotherapy? And I said, no, it's so much more than that. It's really, it's a very, very, very specific degree that takes great effort to obtain. It's many years, it's in America. And it really looks at the alignment of the body. And we have been given this wonderful body, and this all this musculoskeletal organs that we carry around, and the posture that we're carrying it around is just so important and vital also for the inner organs. So it's not only if we have scoliosis, or if we do stand up correctly or not. It's really how vitalizing this posture is to our general health and to our vital organs. And I'm really, really happy to be here tonight with Spiros Michalakis, who's extremely experienced in pain management, in the whole neuro-osteopathic aspects of well-being. And I think it would be wonderful if you could shed some light on your specialty, if you want to say so, in that sense. Where did you come from? What did it take you to do? What is your journey that you have really have you crossed, and gives you this experience and this amazing touch that just with your hands you can actually tell what's going on. That's why I always say Spiros is my magician. And there's just so much more to it. So Spiros, welcome. Just be aware that we are usually a circle of women, and of women community. I don't know how many husbands listen in, but officially we're only women. And I think we have all been in the situation that the lockdown and the sedentary life with sitting in front of computers and not moving around, and gyms being closed, personal trainers not being allowed, exercise in general has been come to a standstill almost, other than a little bit of walking. And I think it has major effect on pain, on body shapes, on posture. And from my side, I can tell that I see a lot of pathology appearing within this last year, 1 year and 1 month that we are now in lockdown. I would like to take your take on on this whole thing. But first, please tell us a little bit more about you and what you've done, and what is your magic? What is your specialty? Where do you come from? Thank you, Spiros, for being here. And let me just quickly say, Spiros, because I can say a little bit on your posture. You know, the first time I did a live, I was terrified. I really thought, oh God, I'm going to die, and how we're going to do this. And it's, you know, it's just as if we're going to have a little talk between ourselves, and we're just blessed that other people are listening. So totally relax. You're wonderful, and don't worry about it.
Okay, so I'll remove my tie then.
Yeah. Your coat.
How many ladies are watching? Okay, it depends on how many ladies are watching. To me, having this around me, it's very, very, very common, because around 80% of our patients are women. So I don't know if that tells something. Women are more sensitive to the changes of the environment, social environment, physical environment, whatever. They understand very fast what's going on subconsciously. They react very fast, and you see a lot of things going on their bodies. And that's a great, let's say, message from the environment to us. So if you take notice of what's happening on women, it's easier to see the whole world changing. Now, where I come from, to me, things started without me really knowing where I was going. Actually it's a trip which started some 35 years ago, 30 years ago, and it continues, and it has a lot of magic in it, because I feel blessed since I had 3 great mentors which shaped my idea of how to treat, how to face human bodies, how to face the nature of pain, the nature of body, and what to think of someone who comes into your practice and say, I'm in pain. There has been a transformation on me since I started some years ago. In the beginning, I was monitoring the body as something very, as a mechanical universe. With years and experience and different, let's say, perception of what this is, I came up with the idea this is not a mechanical universe, but this is a universe of emotions and neurological programs. We see neurological programs really directing our daily activities, from locomotion activities to organ activities or whatever. Everything is let's say, directed from a neurological program. All details exist. Posture is just an expression of what we feel. If we are happy, you can see it in our expression in the body. I mean, the way we sit, the way we stand, the way we move. You can see a happy person. If we're sad, then again you can distinguish someone who's sad from a distance, because you'll see him flexed. He's not truly flexed, but he's definitely not upright. So he's someone who you can tell that probably this guy has a problem, and he walks skeptical, thinking. So the posture is just an expression of who we are and what we think and how we deal with daily stuff, and what do we think of ourselves. Someone who has a low self-esteem has a different posture from someone else who has high self-esteem. So someone who's happy with what he achieved during the day, he has a different posture than someone else. So it's something like it's like nice. It's a nice photo of a sunset. Someone takes better pictures from someone else and use this photo you like. This is a better posture. The other photo, it's okay. It's a physiological posture. Physiological is a very great, let's say, a universe. Yeah. So I started some 30 years ago, no more. Oh my God, I've become 51 already. So it's more than 30 years ago. I started studying physiotherapy here in Athens. And after studying physiotherapy, I decided that this was not enough. And so I wanted to do more, because physiotherapy provided me with some tools to treat pain or to address problems in people, which were not sufficient enough. And so I wanted to expand, and I wanted to grow bigger. So I wanted to learn more. So I went to the States and the MSU, where I did this 5-year study of osteopathic medicine, which led me to another level of understanding and being able to affect people or help people. And by the end of 2001, almost the beginning of 2002, I returned to Greece, and I thought, okay, I am very good now. And then I bumped into Professor Levitt from Prague, and I absolutely started over. I stayed. Levitt was already 86 by then, so I thought that I could really learn from the guy just by being at his side, by his side. And he was very well known worldwide. I knew him from books, from papers, from videos, from courses, but I never had the chance to meet with him. And when I finally did, and I asked him to be his follower, or to be his just side bysider, if you would say so, in the examination room, he said no. And I was shocked, and I told him, why do you say no? I just want to be there and see how you examine, how you treat. And he said, I'm already 86 years old, so I don't think I could have another student with me. Hearing from somewhere when you have already 2 university degrees that he sees you as a student is a bit shocking, but gave me the idea that knowledge never stops. So I kept on pushing him to accept me. And after some months that I was really pushing him, calling him, trying to tell him that, listen, I want to see how things are working with you, because I know you do very different stuff. He accepted me. And by the beginning of 2003, I was at his practice in University Hospital Motol in Prague, which was my place to be for 13 years. Until 2016, when he finally passed away at the age of almost 100. So wow. He became my mentor and my professional father, I would dare to say. He introduced me to a very neurological way of examining things on a field that I was thinking that is probably dominated by the orthopedic way of thinking, which is a more biomechanical way. To me, this has been a revelation of how it's a new way of thinking, actually, how to see the interconnections, how to influence body functions from other areas or from other functions, and how you can examine the true problems and not overemphasize in addressing the symptom. Yes, thank you for saying so. To me, this has been a very, very, very interesting thing. I kept on going to Prague for 13 years. I've been to Prague 78 times. So I think, yeah. Which is something I still cannot believe. I see all those dates and everything. I have everything registered because I kept a very detailed diary with visits and things we did, because with every time we did something different. We had our patients every time. We had every time we were seeing about, let's say, 70, 80 patients per day at the university. Yeah, the university hospital. So it was something. I remember returning to Greece and calling some of my patients to come back and be re-examined by me free of charge, because I wanted to see whether I would see the same things on them as I was seeing prior to our meeting with Levitt. So I remember clearly.
What do you think made the shift? You know, I mean, if you apply this to women and women's health, I mean, the neurological knowledge that you acquired with Professor Levitt and these years of being on his side and, you know, tapping into his immense knowledge and experience. I mean, where would you say has been the shift for patients, for women, compared to your traditional approach that you learned?
A basic, very basic thing was how interconnected is everything to the function of the abdominal wall and the importance of the abdomen. And women very, very often getting operated in the abdomen for many reasons. So they also have the menstrual pains. They have pains in the abdominal area from many different issues. And also there's a beauty issue, meaning they want to be beautiful for us. So they have this sensitivity of what is happening in the abdominal area. They want to be fit, they want to be well-shaped, they want to be with no extra kilos, they give birth, so they want to recover after giving birth. They have this nice and repeated C-sections. So it's a very, very important area for women, and that is also something we can use. This area is something we can use to address pain in the spine, in the lower spine, thorax, the cervical spine, or pelvic pain. We can solve from there. We can treat the scars of the abdominal wall. We can activate inhibited areas of the abdominal wall. We can provide more stability for the spine. We can make pains in the arms, so the upper, the lower extremities go away from there. And it's a key link to interconnecting the upper part of the body to the lower part of the body. So what made me think more about women and their body health was the shocking feeling that there's too many things going on in the abdominal area, which we never pay attention to. And we have to, because otherwise you miss a whole link. So it doesn't make sense to treat the neck from the neck alone, or to treat the spine, the lower spine from the lower spine alone, since there is something that you can really use to improve what you do when you have a problem in those areas or elsewhere. So the abdominal area, it's a very important area, a very neglected area when we come to spinal treatments or spinal pain or cervical syndrome, low back pain, sciatica, thousands of names we use every day, but they are all functional issues related to a very significant functional link, which is the abdominal area, the abdominal wall.
And the abdominal wall, I mean, for me as a gynecologist, I'm always amazed of how unaware women are of their pelvic floor. So they don't really appreciate or even, you know, localize this area within their abdomen. And and I would like you to expand a little bit on the pelvic floor, because it's also, I think, especially with the you know, with the gynecological health, it's an extremely important organ which belongs to the abdominal, you know, cavity, but it's just really you know, important for the positioning, for the, you know, for the control of the bladder, for a big problem for women, which is incontinence, and, you know, not being able to hold the urine. It's a big taboo, you know, issue that nobody really talks about. They're almost embarrassed about it. And pelvic floor and abdominal wall are really, you know, one, you know, they're united, right? I mean, this is something that it's so important to really enforce.
That's very true what you said, and the pelvic floor is just one part of a great cylinder. Let's imagine of a great cylinder which has on top the diaphragm. On the side is the whole abdominal wall, which ends on the spine in the back, and at the bottom we have the pelvic floor, which is not one thing, but it is a formation of different muscles, and they form a pelvic diaphragm actually. So this pelvic diaphragm co-activates with the abdominal diaphragm, and they're supposed to be able to produce, to counterbalance, to produce increase of the intra-abdominal pressure, which also is absorbed by the abdominal wall, and at the end it ends with supporting the spine. So what we see in many cases when we have all the problems that you mentioned before in the pelvic floor area, we have similar problems on the abdominal in the abdominal diaphragm. Meaning, if we have hyperactivity in some parts of the pelvic floor, we see hyperactivity at the same, let's say, at the corresponding levels in the abdominal diaphragm. So if you palpate and you see pain because of muscle spasm in the abdominal, in the pelvic floor, then you palpate the diaphragm in the thorax and you see also increased activity and spasm and pain. The thorax ends up in a specific, the thorax ends up, in a more inspiratory position when it should be more level. And if it's not level, then the outcome of breathing is not sufficient to really activate the co-contraction of the pelvic floor. If you have inspiratory position like this, the thorax should be parallel to the pelvis. So if you, for some reason, you are here, then the force produced by the diaphragm while breathing is not sufficient. So if that does not give you stability, to be able to provide stability, you overactivate the muscles of the spine, and they get really stiff, and they get a lot of muscular pain, plus they limit the mobility of the vertebrae. So that ends with problems on the discs, on the small articulations between the vertebrae, and eventually. So pelvic floor and its functional health, together with the functional health of the abdominal diaphragm, are very important for experiencing or non-experiencing pain. So if we examine those areas and we find different function than what we would like to see, then that is a predisposal factor for having pain in the spine, either lower or higher. Could be also on the neck or elsewhere. So what happens? The system has a very magical mechanism, which is breathing. Breathing also, it's something which unfortunately is affected by how we feel. So imagine a lady who works from home now. She's not working. She doesn't go to the office. So she has, instead of sitting in a nice working chair, she has to sit on a sofa and have a computer in front of her and work more hours and being stressed with what's going on because the lockdown exists, the coronavirus exists. So the first thing she does is that she modifies breathing patterns without she knowing it. And since breathing produces a lot of things, higher, lower, everywhere, pelvic floor, diaphragm, the extensors of the trunk or the abdominal wall, with her knowing it, she has started changing how she sits, how she stands, because it's something she really keeps on doing it even after she gets up from the sofa. Actually, breathing is one of the major things that make us, during this season of the coronavirus, that make us feel more old, I should say. Modifications of breathing make us feel more old. We feel more rusty. We feel like with what? Sorry?
Absolutely, I could relate to that. I think you feel more stiff, you feel more sort of, less flexible, and, you have more morning stiffness. You can, you really don't move that much. I hear that every day from all the patients. They have gained weight, they have lower back pain, they have developed belly fat. They really, I would say 6 women out of 10 complain about that. So this is something that they have really, acquired within the last year. I don't know if you saw the slide with the frog looking out of the window, which was very nice and slim in 2020, and then 2021 was like a round sort of blob looking out of the window. And I think, what you're saying, Spiros, with the breathing is also something that we take so for granted, right? I mean, we don't even think about the breathing, and let alone work on it. And I think if we, it would be nice if you could maybe give us some like practical tips that we could do, in order to improve, maybe like a 5-minute little routine of what could be done to counteract these problems. It's also the angle to the computer, that you look down because it's a laptop, or it's not in the same height with your eyes because you sit in the sofa, or you're on the kitchen table, you do 5 other things at the same time. I mean, in my opinion, this whole pandemic is really carried on the back of women, having to multitask even more, with working at home, with the kids at home, with not being able to have help at home because you're worried to have somebody to come home. I mean, it's crazy. And I don't know what you see in your practice, Spiros, but for me, it's a constant complaint that I hear every day. And I think it's a significant shift towards the abdominal area within this year.
If we want to give some simple instructions on how to use breathing to somehow decompress or change this poor posture thing, it would be easy. It's very easy. We have to let's say remember how to use the thoracic cage or the abdominal wall in 3 axes. The more we get stressed, the more we tend to use thorax for breathing. Plus, we tend to use thorax as an elevator, this way. Thorax is like a balloon. It expands in 3 dimensions. So the first thing what someone could do, a lady could do, to improve her ability to activate in all axes would be to place her hands on the chest here, with no pressure, just feel it. There, perfect. And just try to breathe in your hands. Breathe in and breathe out slowly, just feeling the air, making the ribs go laterally.
Yeah.
Okay? That's number 1.
Okay.
At the same time, when you breathe out, you have to remember to let it relax, because some people have what we call a shallow breath. So they have this tendency of overactivating when they go in inhalation. So they do this major inhalation stuff and they relax only 50%. So they have to let it go. Yeah, give it time. It doesn't have to be from the nose and from the mouth or all that ideology stuff. The air goes only in the lungs. So just breathing any way you feel and let it go any way you feel. Just give it some time to relax. Let's call it exercise number 1. Now, what happens? When you're breathing on the side, sometimes you have the tendency of lifting the shoulders up. So you have to let the shoulders relax. That's a common mistake some people do. So when you try and breathe on the sides, try not to elevate the shoulders. Because if you elevate the shoulders, you take back any benefit you can get from this exercise. So have your shoulders being relaxed. Now, I'm going to show you 3 exercises in total. Exercise number 2, you do exactly the same, but your palms are now placed on the side of the abdominal wall here, a bit lower. And the only thing you do is try to breathe there. Feel the breathing expanding the abdominal wall and relax. Breathing and breathe out. Breathing and breathe out. Remember, if you're breathing a lot, then really breathe out after that. Don't stay in breathing in situation. Because if you stay in breathing in situation, that again increases loading in areas that you don't want to load. So breathe in, feel it, and breathe out. Okay? Let's call it exercise number 2. And now we're going to do a trick. So far, we have been using our palms parallel. Now we're going to do this maneuver and put it again on the abdominal wall at the same place we were before. But now we are feeling it also in the front and in the back. We make an arch. This.
Yeah, okay. Can we do this, Canelli?
Now, there are 2 things you can do from here. From sitting position as we are. Exercise number 3. So we can activate as an exercise, meaning contract. We can contract our abdominal wall exactly where our fingers are and feel the activity. It's like doing abdominals, but without moving. So we contract, and that also activates the pelvic floor. And relax. It's very easy. You just have to feel that your fingers are really experiencing push from inside. And relax. Again, push and relax. You will feel the abdominal wall expanding, which is exactly what we want to do. And you can do it easily for 10, 15, or 20 times. It has a very nice feeling on your tired low back after you do it for some 10, 15 repetitions. If you, let's call it exercise number 3. I will give you also a 3A exercise. If you have problems activating this way, you can also use breathing again, but you have to breathe in the whole area that you are touching. So you can breathe in and feel it going in activity. Feel the activity going all the way to your thumb and relax. Breathe out. Breathe in and breathe out. Don't be afraid that you're going to experience a big belly, because this big belly is not fat, is not going to stay there, is going to be more active. So gradually it will get smaller. So don't be afraid of it. Breathe in deeply, feel it, pushing your thumbs and fingers, and breathe out. That's exercise 3A. That's it.
And where's an A is also B, no?
You want a B?
A 3B. If there's a 3A.
On the 3B from the same position, I take the challenge, Sabine, so I'll give you another one. So if you're sitting with your knees apart, then make them come the nearest that you can touch. The knees should touch in, each other. Or if you have problem with that, take a towel, make a cylinder with it, and put it between your knees. And the moment that you push or inhale, try to push your knees together. Try to push inside, knees inside, and activate.
Oh, that feels good.
It should be feeling good. It's a very nice exercise.
Very nice.
Yes, plus it's really working with the low back. It will give you a nice support in the low back, and relax. And you can do it without anything going wrong with the position that you're sitting. You can do it from any sitting position.
Mm-hmm.
And it's really a 3B. We can also give the 3C, 3D, 3E.
No, but I was just thinking whereas an A must be a B, otherwise
No,
that's very helpful, Spiros. Thank you very much. And you can do it like as a small break, right? I mean,
yes.
in between between a call or in between a patient.
Yeah, you know what we do? We set an alarm for every 2 hours on the mobile phone, and we do every 2 hours. We do a 5-minute break, and in 5 minutes you can easily do these 3 exercises. It's nothing you can do. It will give you. Actually, I feel good now that I've done it. Just by activating. Since you activate the system, you will feel much more relaxed. And if you have pain in the low back or elsewhere, it will be easier for you to relax from that pain. And if you combine it with a change in posture for a while, getting up from the sofa and walk a bit or do some movements, you'll be fresh again. Of course,
a lot of women always ask me if there's a problem if they sit cross-legged. You know, when you sit on your computer, on your desk, and they, you know, many women, they just cross their legs and they sit for hours with. Is there a problem from the osteopathic side, postural side? Is that something we should rather avoid? Should we, you know, I don't know. Is there any contraindication to sit cross-legged, or is that something that?
Well, men like women when they sit cross-legged. So it's a nice thing to see, but functionally, it's a very demanding position because you limit the systems that have to support you. Meaning, you decrease the size of the area that takes the whole loading from the sitting position. You make it much smaller. Plus, you impose stress on the sciatic nerve, on the area which is on top, on the leg which is on top. There is a lot of stress on the piriformis, and through piriformis, sciatic nerve goes through, and therefore it's something which is a bit risky. Plus, you increase the activity of the extensors of the spine, which also have to balance because you cross and at the same time you rotate and you do little side bend. Yeah, exactly that. So many systems have to be co-activated to keep you this way. So if you were in economy, I would say that this is a nice thing to do, but it will cost you billions of euros. So don't pay for that. Go safer. Don't overdo it. Yeah. Of course, women love this position as well. So I don't want to, let's say, to fight with them, because it's a matter of also how you feel with the position. Because
from a functional side, I was thinking, you know, from a functional side, it's definitely, you know, it's taking a toll on your whole balance, I would think.
Yes. It's very demanding, and I wouldn't do it for long. Or if I would listen, the problem is that sometimes what happens if you sit cross-legged, then at some level your system gives you a feeling of something like you don't feel so well with the position anymore. But if you do it during working time, your mind is focused elsewhere.
Yeah.
That you don't take under consideration, you don't pay attention to the feedback that your system is sending you when it just starts. You have to feel it after it gets to a level, and usually this level doesn't give you just a feeling anymore, it gives you pain. So you understand the problem when it gives you pain. You should be able to feel it prior to the level of pain, because when you give pain, and no matter if the pain goes away afterwards, the pain has a very specific organization that the system has to follow to overcome it. So you are messing with many things that you don't want to mess. So it's more clever for you to feel it early, and to be able to feel it early. Do it only when you go out having a drink or something else. But when you do something that requires focusing, don't use this posture. Don't do this position. Don't take this position. Of course, it's very common.
It's very.
Of course, it's very common. It's very commonly used.
Very commonly used.
Yeah.
But it's you know, I always get this question, and I kind of answered it, obviously not as profoundly as you do, but you know, I think it's not beneficial. But also coming back to the breathing, I mean, if you do, you know, this deeper breathing and the more functional breathing, it also increases the blood perfusion in the peritoneal sheath of all the organs, and that, I think that's really also where you help the function of your vital organs. So it's not just the muscles, it's also the gut, it's the spleen, it's the liver, it's all these organs. They are covered with with the sheath that we call peritoneum, and these are, you know, in a way like the covering protective sheets that the organs have around. And if they get perfused, you know, better because you follow, you know, the simple exercises that Spiros has just shared with us, it's just so beneficial. So I think, you know, if we go back to basics, you know, what we say on our level is that, you know, we want to take serious the little messages that the body sends us, and you know, draw conclusions before we actually get into pain. And I think it's just been very, you know, very helpful to, you know, to just be aware that, you know, breathing is one of the things that we've been given and we take for granted, unless we have a cough or we have a pneumonia or, you know, terrible other things happening like COVID. So thank you, Spiros. That's very good. But coming back to your therapy, so when you do experience pain, or you do have, you know, discomfort, and you know, your magic is that you realign, right? That you you know, you might come with a pain in the neck, and Spiros, you know, works with your knee, and you might be thinking, you know, what on earth is this guy doing? Didn't I come for my neck? So let's just talk a little just talk a little bit about how, you know, what are these neurological patterns and programs that you're actually addressing when you address the pain. So it's not just locally the pain, it's really so much more to it, and it's so much more looking where the pain has been created rather than just killing the symptom. Is that correct? Or
yes, it is correct. Thank you for asking me that. There is what we call chain reaction system, meaning that since we our locomotion is in 3 axes, or we have to deal with gravity in 3 axes. We have developed through our evolution mechanisms of activity to be able to absorb loading and to be able to move ourselves forward in a very safe and a very shock absorbing mode. So what happens? There are interconnections, functional interconnections, which unfortunately cannot be seen in a very detailed examination like an MRI or something. And fortunately, we have methodological advances that allow us to be able to monitor how the areas are interconnected. There is a whole system exam which is called developmental kinesiology exam, and which we use to be able to see how much the true, no, let me rephrase. There are some protocols we can use to be able to see if all areas are coordinated in absorbing loading in an ideal way. Most people that are on the streets are not working as mechanical systems, are not working ideally. They're just physiological people. But the brains have all information necessary to make us move in an ideal way. So what happens? We know that to be able to support the lower spine, something has to be happening at the gluteal area, something has to be happening at the knee, something has to be happening at the ankle or the foot. And this comes with a specific quality when examining, meaning when we examine the soft tissues of the foot and we see a specific response, a specific reaction, we know that go to the calf muscles, we have another reaction. We go to the knee muscles, we're going to see another reaction. We monitor reactions. If the reactions are at the range of physiological, then okay. If we see modifications that exceed the range of physiological, then we have a problem. And how do we know that this is not in the range of physiological? We always co-examine the other side, the other leg. Like if we palpate the calf muscles at the right and we see increased reaction in palpation, then we cross-examine the other leg to see if we also find increased reaction on the calf muscles on the other side. So that gives us an idea of the activity and how increased it is. When we find specific areas with increased activity in the soft tissues, then we go into examination of the articulations, the joints. If we also see problems there, or if we see modifications in the function of the joints there, we start to create a picture of dysfunction on this specific person. So although he's complaining for a pain in the thorax, we examine the thorax and since there's not any border between the thorax and the lower spine, we have to go lower. And since there is no limitation in the movement between the lower spine and the pelvis, go in the pelvis. And since everything develops forward, we go on the hip and then we go on the knee. We have to. And we stop only at the area when we don't see that the dysfunction goes lower. So the body directs us, tell us where to go, how to go, why to go. So the first thing we have to learn is how to really go in the areas that are necessary and how to feel the body of the patient, how to be in contact with the body of the patient. And to achieve that, you have to make a connection with the patient. You have to really connect to his nervous system. Though the patient has to accept you as his treatment specialist, and he has to feel secure. He has to feel that if he describes something, you have your ears open. You will not see him just like another patient. You have to devote time and energy to feel what he feels and establish a connection and start from there. So the examination of the areas is directed by neurology, meaning which areas support which areas, because there is a protocol for that. It's directed also by dysfunction. The dysfunction goes up to this level. Okay, so we treat everything which is related up to this level. And it's also directed by the description or the feeling of the patient. The patient allow me to go up to this level. So no matter if I go elsewhere, I have to limit myself and gradually make a treatment plan which is more expanded. It's not
it's very complex though.
Yes, unfortunately, there is no easy. I've tried to describe it many times in the past, and I come to the conclusion that there is nothing easy that you can say. It's a very complex anyway, because function is complex. An explanation we were giving in the past is this. During the first year of life, we start from a human which is not moving, especially in the beginning, and at the end of the first year and a half, we have a human which is moving independently without any previous training. So what happens? What happens is that during every week and every month and every semester, the nervous system works like a computer which gets new programs and new qualities. And these qualities are integrated in a greater motor program together with other programs as well. And at the end of the first year or 18 months, you have a very efficient motor program being able to direct you through your daily activities. So since we know, because this is everything is monitored, everything is registered, now we know what happens every month. Since we know exactly what happens in every month and how things should be coordinated to allow us to move freely, we can take a grown-up and examine him as if he was a baby, and examine him with the quality that he should be able to use at the 3rd month, at the 6th month, at the 9th month, the 12th month. How does this apply when someone comes with low back pain? We examine this person as if he was a 3-month-old baby, and if he was a 3-month-old, he should be able to hold a position on the bed in a very specific quality, meaning the thorax should be doing something, the pelvis should be aligned, he should be able to breathe in a specific way. Minor things we can always examine in an adult. So we examine him this way and we see that, okay, he's missing that quality or he's missing the other quality. So developmentally, we can give him with exercises, we can give him the quality he's missing to be able to take his pain away without really intervening in the system. This is a functional, let's say, explanation, but again, it's a bit complex. No easy way.
I just want to share, you know, I had the privilege I think it was a year ago, I came to visit you on the recommendation of Dr. Sabine, and not knowing much about the osteopathic world. I mean, I don't know if you remember my experience, but I felt that it's almost like a psycho-spiritual, neurologic expression. It's like you literally, you hardly touched me. I'd come in for a stiff neck, right? And the next thing I know, I'm having this experience like I'd just been born. I was literally felt like I'd just been born, right? And that I was my 46-year-old self here in Athens, but I was simultaneously in Cape Town. It was like this, I can't explain what it was. And then I just literally, I cried like a baby. I mean, he was so polite. He stepped out of the room. He was just so polite. But it was this release. And then he came in and he just said to me, "Jeez, you're so lucky you had that release, you know?" And that was it. I mean, it was unbelievable. I mean, you know, so I understand when you say, I mean, you're almost tapping into that, whatever was missing from that time, you know. I mean, I had, for the first 2 months of my birth, I was separated from my mother. So it's fascinating. I find it really fascinating. And so I mean, you're almost saying that, and we know this, there's no time and space, right? So the body is the messenger for what's happening. And we've had a couple of comments now on the Facebook group, and you know, when there's a pandemic, it's going to ignite our stress response. So obviously now everybody's PTSD, everybody's way of coping is coming to the forefront. And the other thing that I was thinking the other day is that nobody can have the ability to look to the future anymore. Because if you want to go on holiday, you can't. If you want to plan your this for summer, you can't. If you want to plan Christmas, you can't. So the tendency for people to be visionary, to connect with their third eye, is gone. And what does that, how does that impact the body on an energetic level, right? So then people are forced now to come back inside and actually feel the pain, right? And we don't know where this pain could be from any time.
It's amazing, isn't it?
Yeah.
It's so true. It's so true. I mean, it's tapping into this big memory chip that are called cells. And they just remember. They remember events. They remember things that you don't even remember in your consciousness, but you know, they come out in your subconsciousness. And probably the fact that you cried was like a huge release, you know, that also let go of this, you know, almost like you know, like a you know, short cut in a neurological sense, and got relief. So
You know what?
I always feel that with you, that that's why I say he's my magician. You know, it's not just clack, clack, clack. It's really, he taps into your, you know, it's almost like biohacking, you know, into your memory chip of cells. And that's why, you know, it's so relieving and it's so curing and healing.
You know what is also very, very impressive when I see that, and I see that every time, the repetitiveness of the response. What I mean, let's say that we have someone who has a neck problem, and by examining, we find that we have to treat the abdominal wall. Okay, no matter how many times we do that, and no matter how many patients we do that, every time we treat the abdominal wall, there is an improvement in the cervical spine when it's necessary to treat the abdominal wall, meaning that there is a pattern. And although we don't know why, we can't explain why, there is an underlying mechanism that really makes this system operate as one thing. So the more you see that by acting on one part, there is difference on the other part, and you don't see that by coincidence, but every time you see that, and next time you are going to do it, you know that you're going to see the same response, and you see it, and then you see it again, and you see it again, and you see it again. It doesn't matter if you cannot picture it in the MRI, you know that there is a mechanism that makes you respect the system more, because it's a very advanced system. There are many, many things we don't know about it. So establishing the connection with the patient always comes first. And when you establish connection with the patient, then you might get responses like the one we had with Anneli. And this is not the first time we see that. We see it, I would say that now with the pandemic, we see it more often. It's like there's a lot of energy inside, it wants to go out. So just by touching, after established, yes, it's like an explosion. And you see, you see
what I felt.
Yeah. And then you see the patient during the initial exam in a specific way, and when he comes to the first treatment, it's like he's reintroduced. He's not the same anymore. He's more relaxed. He smiles more. He's more confident. He speaks up more loudly. He breathes up. He breathes in and out better. So we see differences just because we saw that in the first place. So it's amazing, and I'm very happy and very proud to be able to do something like that. And also I feel very privileged to have met all the special people in my life, including you, because you are a very special person, and you are allowing me to do all this stuff without fearing of what's behind, meaning you trust me so fully, and I want to say thank you for trusting me so fully.
Very, very, very well invested, my trust, I would say. Canelli, I mean, he's just wonderful. So I think we should put in the chat also the details of Spiro. So if anybody wants to reach out and maybe, you know, get an assessment and have a look at what's been bothering you for a long time, short time, whatever, it's definitely worth, you know, an assessment and a try. And I really thank you very much, Spiros, for your time. I know it's been a long day, like every day, and you have gifted us with 1 hour to our audience and to just shed some light on, you know, on this precious thing called body, that we should just, you know, look after it and nourish it and not abuse it all the time. I mean, this applies to all of us. I mean, hello, I'm also one of those workaholics. So thank you very much. And it's been a pleasure. I hope you're going to get some rest now, Spiros. It wasn't that bad, was it? It's just like having a talk. It's really...
It was really nice. Thank you, thank you, thank you. Thank you very much.
Thank you very much, Spiros. Canelli, thank you very much, as always, being our IT specialist and inspiring us with your energy. It's always wonderful. So I'm wishing everyone a good week, hopefully tapping into summer. And we'll be back next Monday with another interesting topic that we'll let you know. And be well and be safe. Good night, everyone. Bye. Bye-bye.
Bye-bye.
Bye-bye.